Hello, my name is Diane Kaufman, and I'm here to tell you about the If My Words Could Make a Difference Youth Mental Health campaign. First, I'd like to start off with a poem. One alone, many together, to love and care, it starts with one. Be the one who loves, be the one who cares. Be the one who makes the difference. One person can change the world. You are important. Your thoughts, feelings, and observations are important. What if your ideas could help change the world? What if your ideas could help improve the life of just one person? It would be worth it. I'm happy to announce an award winner for the Mental Health Advocacy, Education, and Community Collaboration Grant sponsored by the Oregon Council of Child and Adolescent Psychiatry. And you guessed it, If My Words Could Make a Difference, Youth Mental Health Campaign has been awarded an OCAP grant. I want to thank OCAP, Oregon Council of Child and Adolescent Psychiatry, for their support, and also ASHA International, as well as Mind Matters PC, and Creative Lifelines, which is part of Mind Matters, because we're all working together to bring If My Words Could Make a Difference to you. I'm Diane Kaufman, and I'm a child psychiatrist. I'm dedicated to transforming trauma and despair into creative resilience. And I have bipolar disorder. I share that because when one person breaks silence, the truth in all of us grows stronger. I want to let you know how the If My Words Could Make a Difference campaign emerged. Have you ever had the experience that you just had something so much inside you that you just had to say it or write it or sing it out loud? Well, that's what happened to me a couple of months ago. And I was inspired after listening to a number of my youth patients who happened to be talking of their anxiety, depression, and suicidality. And even some of them shared with me how they had in the past attempted suicide. One youth told me that they didn't want me to know about their suicide attempt because they thought I would take it seriously. And of course, I would take it seriously because they're important and their life is important. And out of all those thoughts and feelings, I just had to write something. And so I wrote, If My Words Could Make a Difference, this is what I would say. And now I'm going to share with you that essay, which led into, miraculously, this grant. If my words could make a difference, this is what I would say. If you were having symptoms of a heart attack, would you call yourself crazy, or would you call 911 and get help? Here's what I'd do. I would definitely not be calling myself crazy. I would be calling 911, telling them it was an emergency, that my life was in danger, and I need the ambulance and paramedics sent as soon as possible to get me to the hospital. If I could not call, my loved ones or friends would call. Even a stranger would call if they saw me collapse. If I saw someone in such a crisis, I would make the call to 911 myself. And what if medicine or life-enhancing therapies such as nutrition, exercise, sleep, and stress reduction could help save my life? I would ask my doctor to educate me on the best heart health practices. I'd ask for prescriptions and referrals because I want to stay alive, be healthy, and I don't want to die. So why do we insist on thinking our brain is not part of our body and act so differently when our brain health is at risk? Why do we dismiss or hate ourselves and or think others will ridicule and or shame us if we have a mental illness? Maybe in part, it's the stigma we feel and fear we'll feel that's so associated with the words mental illness. I don't like how that word has been used. It's said in disparaging ways, in unkind and untrue ways, as in, she's mental and he's mental. Mental meaning crazy, less than human, and aberration, being other than anyone else. Just pull yourself together, snap out of it, stop wallowing. I'll give you something to really cry about. That's some of the unhelpful comments we may hear. And how about it's all in your head? Meant as a put down, but in reality, that's true. Inside our head is our brain, and it needs help and not sarcastic shaming or demeaning remarks and criticisms. Do I call my lungs crazy when I'm having an asthma attack? Definitely not. My lungs are not well, yes, but crazy, no. And what do I do to help myself? I'll use my inhaler. If I'm still in acute crisis, as in I'm wheezing so much that I'm having trouble breathing, I'll get myself to an emergency room. Will I be ashamed of being asthmatic? No way. I will tell the nurses and doctors that I have asthma and ask for medical help. How different, though, it can be for psychiatric illness that strikes at the brain. It's essential to remember that the brain is part of the body. Mental illnesses are in reality physical illnesses. Our brain and our mind may suffer, but that does not mean we are Looney Tunes, crazy, or nuts. After all, the brain impacts our whole being, how we think, feel, act, speak, eat, sleep, and more. Think of it this way. When our brain is attacked from inside itself, we might experience a depression attack, manic attack, anxiety attack, panic attack, suicidal attack, self-hatred attack, what's the point of living attack, an urge to self-harm attack, body image distortion attack, and other such attacks whose source is invisible from the outside, while all too painful and real from the inside. Our brains are not crazy. These types of attacks are just as real, just as important, and are just as in need of help as when we have a heart attack. A heart attack can be life-threatening. A brain attack can also be life-threatening in terms of life and death, as well as the ongoing quality of how we are able to live our lives. Let me ask you this. Do you know that suicide is the 10th leading cause of death in the United States? In Oregon, the number one cause of death for ages 10 years old to 24 years old is suicide. The second leading cause of death for ages 25 years old to 34 years old is suicide. And the third leading cause of death in Oregon for ages 35 to 44 is suicide. These deaths that did not have to be, the flesh and blood lives that could have still been lived, now forever lost into the abyss of suicide. We must be vigilant and aware of psychiatric brain attack warning signs, such as change in mood, suicidal thoughts and actions, self-harming, change in sleep and eating, alcohol and drug use, anxiety, panic, and despair. Our brain deserves respect and it deserves help. We deserve our and others' understanding and compassion and not the cruelty of being shamed. Silence, shame, and stigma must be banished. That will happen when the truth about psychiatric illness is known and we bravely share our mental health stories. Let's make everyone aware that illness attacks on brain health are real. They can be life-threatening and should be approached just as one would any other health crisis. Now that you know the truth and that medication and/or therapy help is available, please don't become a statistic. Save your life. That's what your brain and your heart wants you to do. Have my words made a difference? I pray that they do. The National Suicide Prevention Lifeline number is 800 273 8255. I wrote that essay spontaneously back in December 2020, and now it's April, and already those words are making a difference. So from my heart to yours, I ask you, what words do you have to share that could inspire and improve your mental health or the mental health of your peers? We want to listen to what you have to share because you have the lived experience, and based on that, we can make improvements on how mental health care is provided. Please go to Asha International at myasha.org to learn more and to submit your writing, which can be an essay, a story, a play, or a song for the If My Words Could Make a Difference Youth Mental Health campaign. Thank you.